Welcome back. The healthcare industry shifting its focus to keep patients healthy rather than treating them after they fall ill. This change has seen the industry branch into new areas, including meal delivery and gym transportation. Joining us now is Dr. Mikhail Varshavski, also known as Dr. Mike. Dr. Mike, good to see you.
Good to see you.
And we're living longer, so this is sort of necessary.
This is absolutely necessary. It's about time.
Yeah.
I've been a huge proponent of pushing our healthcare in the system. In the United States, we spend more per capita than any nation on the planet. That's incredible because our results, our healthcare outcomes are not that good. And the reason that is that we don't focus on preventive care. We tell a patient, here's what you need to do to stay healthy, but don't give them any resources or any education on how to achieve those goals. I have patients that I've worked with in the past in urban care centers. They would come in with a congestive heart failure exacerbation where they can't breathe, perhaps because they weren't eating the right foods and had a lot of salt intake. We would get them stabilized. We would send them home, only to find them in the ER a few days later because they don't have access to quality meals. So to have meals delivered to folks that are the right meals, the correct meals for their conditions, to have transportation, to go to the gym, to go to their doctor's appointments, that's so important. There's been plenty of times where I have a patient come in and I say, okay, you need to see the surgeon on this and this day, but they don't have a way to get there. And then they don't go, and then they get ill and they end up in the ER. Yeah. That costs thousands of dollars.
Absolutely. We spend more money on treating disease rather than preventing it.
Yes.
You know, Dr. Mike, in private equity, we're seeing a lot of shifts towards doctors now doing house calls in extended care and elder care homes to accommodate them so they don't have to get in a car and so forth. And we see a lot of occupational facilities, urgent cares popping up. What's your view on that? Is that really an emerging thing now?
Yes, intermediate level care like that is smart. We want to keep people out of the hospital. And that sounds funny because you would think that we want to take care of people in the hospital. Actually, as soon as you get admitted into the hospital, the first thing we do is try and plan already how we're going to get you out. Why? Number one, it's very expensive. And number two, it's not good for your health. You get more sick being in a hospital because of cross-contamination. Yep. It's just part of what it's like to be in the hospital. Yeah. So the faster we can get you out, actually, the healthier you are. So now a lot of surgeries that used to be you would spend 2-3 days in the hospital, they're same-day surgeries, and we're sending the physical occupational therapist directly to your home, and that's the right move.
Yeah, the doctor's got his boot on your butt. I mean, as soon as you're awake, it's like send you home. But it is
it's a win-win.
There is an upside.
It's a win-win for everybody. Insurance save money, patients get better quickly.
Avoid infection in the hospital.
Well, that's the thing. You want to get sick, go to the hospital.
Think about how great you sleep in a hospital bed with noise, monitors going off, constant commotion, as opposed to being in your own bed. I mean, that's just a choice that most patients would want to make, that they want to be at home.
But these urgent care centers that are popping up anywhere and everywhere, many of them run by large hospital organizations. Mount Sinai is one example. They do such a terrific job, and it's kind of breaking that tradition of, here's my primary care physician. I can only go to this doctor if anything goes wrong. It's an in-between for a sore throat or infection or a cut or anything like that. There's an in-between your GP and the emergency room.
A lot of times, quality family medicine doctors or internal medicine doctors don't have many same-day appointments available. And what ends up happening to these patients is they end up going to the ER for something as simple as a sore throat because an appointment was unavailable.
So let's talk diet in terms of preparing and making sure that you don't get to that spot that you have to go into. What is your recommended diet? And then I want to ask you about this flavored yogurt. Because flavored yogurt, a top treat for kids, but now we're questioning, is it actually good for them? A recent International Journal of Obesity report claims that 92% of parents underestimate the sugar content in yogurt. Sounds true, huh?
Parents underestimate in entirety how much sugar their children consume. There was recently a whole project done by Kind bars, the granola bars, where they dumped in Times Square like 10,000 pounds of sugar, showing how much kids are consuming each year. And that's part of what's fueling, in fact, a significant part of what's fueling the obesity epidemic in our country today. Added sugars, refined carbohydrates, these things are not necessary for our children to eat. They contribute to obesity. They this is really interesting. Heart disease starts when you're about 10 years old. It's that initial layer of plaque that starts forming in your arteries starts when you're 10 years old. So it's important to get your kids off of the refined sugars, use it as an occasional treat and not a healthy snack, which it's not.
Including sodas, Gatorade, Capri Suns, you name it. I mean, it's hidden everywhere, even in the yogurt.
Yes. If you're going to eat yogurt, eat the quality yogurt that doesn't have added sugar. Because that added sugar.
Like the Sigis or...
Like the Chobanis of the world, there's Skyr, the Icelandic Skyr. That's a great protein-rich meal. Yeah, so there's always alternatives for people to look for because added sugars, again, we have to look at added sugars puts on pounds.
Yogurt is good for kids, though, because all the probiotics.
So, again, I hate using the term good or bad and labeling certain things because because it just depends. It depends on whose health you're talking about. But there's a lot of sugar in
flavored yogurt.
Flavored yogurt can carry a lot of sugar in it, and that's why maybe it's not such a healthy meal to eat every day, but use as a reward or a treat every now and then.
Always great advice from you. Dr. Mike, thanks so much.
Thanks.